All right, good afternoon. I hope everyone is enjoying their lunch and has enjoyed the summit so far. Thank you, Aaron.
Should we all sit?
Huh? All right, good afternoon. My name is Andy McMahon, and I'm the Managing Director for Government Affairs and Innovations here at CSH. And I am delighted to join you all today and to be joined on stage by a really incredible set of partners that we have and friends that we have in the federal government in Washington, D.C. As we begin this closing plenary on federal policy, I want to just highlight that as all of you all go back and do the unbelievable and incredible and impactful work that you all are doing, that one of the things that's really critical and one of our priorities here at CSH is to really make sure that we are bringing those messages back to your districts, back to your states, and back to your members of Congress, and really trying to provide the advocacy that is so critical to support the efforts on the policy level as well as the appropriations level that we all want and need to see to scale supportive housing to serve the individuals and families that really, really need it. So in our conversation today, I'm delighted that we have three of our very key partners and champions with us today. And I have several questions, some of which will be for all of them and some specific to great roles people play in Washington. So without any more to do, I'd like to first introduce our panel. So to my left is Luke Tate. He's the Special Assistant to the President for Economic Mobility. And just in brief conversations with Luke and knowing about his work, I think you guys will be really excited to learn from his experiences and really get a sense of how important and how critical and how much of a priority ending homelessness is and expanding supportive housing is all the way up to the top at the White House. To his left is Richard Cho, who is a Senior Policy Director for the U.S. Interagency Council on Homelessness. As many of you know, Richard is a dear friend of CSH and colleague, and we are delighted to have his smarts and effort and work and insight in Washington and working across the federal agencies in implementing the federal plan. So thank you, Richard. And last but certainly not least, to my far left, is another friend and colleague of CSH, Jennifer Ho. Jennifer is a Senior Advisor for Housing and Services at the U.S. Housing and Urban Development and is a stalwart advocate for really central efforts that we're all talking about in terms of how do we integrate, align, complement housing and services, and how do we make those connections. So I'm sure I will do it at the end, but just a huge thank you as we begin this panel to all of them for their tireless work and tremendous leadership. So with that, I'm going to start with the first question for our panel that I'd actually like to put to all of you all. And that is that supportive housing has emerged not only as a solution to chronic homelessness, but also part of the solution to other vexing or wicked problems, like individuals cycling in and out of jail, families involved with the child welfare system, individuals exiting institutional care settings. I guess my question to all of you all is, where do you see the greatest opportunities to adapt and refine supportive housing, to support and assist these populations? And as we think about that, where might there be pitfalls as we think about? Where are there things that we at CSH and all of our friends here should be thinking about that could be kind of potential challenges or pitfalls to that?
I'm happy to start. It's great to be here with so many friends. So just excuse me for just a moment. Hey, Luke, you report to the president. I don't. I was just at a meeting with a whole bunch of Chicago providers, and they told me to tell the president that they're going to get their act together and end veterans homelessness by the end of this year. So could you let him know? All right, thanks. Sorry, I forgot to tell Luke that earlier, so I just wanted
I appreciate you letting me know. I'm going to take that back.
yeah, I just promised I would pass that along from a meeting I was at this morning. So I think that supportive housing is in its prime time right now. It has gone from a concept that we used to try to convince people was a good idea. We had whole PowerPoints that we just explained what supportive housing was. We had a couple studies here and there that said that it was made a lot of sense for the people who got it and for the systems that were paying when we didn't do anything about it. And what I find especially, I mean, obviously I sit at HUD, so I mean, we have a certain affection for supportive housing, but what we're finding is that we aren't having to convince people anymore that it's a good idea. There's one exception, which I think that we don't have the full support that we need from our appropriators on the Hill in terms of investing in it at the level that we all know is needed to solve the many different problems that it's set up to solve. And we spent a lot of time thinking about that. How are we going to get over this barrier of everybody thinks it's a good idea, but we don't have enough? And I think that a lot of it is about doubling down. I think it's figuring out whether we have gotten soft in our efforts. You know, we've been doing so much educating, maybe we thought we didn't have to keep educating. Clearly, we still have more work to do on that front. But I also think it's about envisioning a bigger N. We have lots of studies, but a lot of them are small studies. Mm-hmm. And a lot of them are small S studies. They're not strong research design. Mm-hmm. If we're going to convince the healthcare system to help us do supportive housing at scale, the N of our studies doesn't show up on their radar anywhere. I think to really think about how we look at this in a much bigger way is required because we're trying to get a much bigger result. But it means that we have to think about this. Our thinking about our strategies needs to get bigger.
Great, thank you.
I'm also really happy to be here. As Andy said, I'm definitely a friend to CSH. I'm also an alum of CSH, class of 2013. And also, so it feels a little like coming home for me today here, not to mention the fact that I was actually born and spent the early part of my life here in Chicago, so this is like a homecoming in many ways. But to answer the question, Andy, I think, you know, when I came to Washington, I had this thought that, you know, we need to look at how we can scale supportive housing to end chronic homelessness, and then we need to also figure out how do we scale supportive housing to solve all those other problems. And I think I've increasingly come to realize that those aren't necessarily separate problems, but they're actually quite interrelated. And particularly when you think about the people who are experiencing chronic homelessness and cycle in and out of so many institutional settings, psychiatric centers, jails, hospital settings. I mean, people who are high utilizers of these other systems are also people experiencing chronic homelessness. And so as much as we're focused on trying to scale supportive housing through the homelessness frame and looking at how we scale up the resources that are targeted for people experiencing homelessness, and by the way, you know, much thanks to Luke and others, you know, we have a president's budget that is looking to really seek the resources and investments from Congress to bring to scale supportive housing, specifically asking for an investment that would create 25,500 units of supportive housing in the fiscal year 16 budget. But you know, also, how do we start getting the resources from those mainstream systems who also benefit from supportive housing, the healthcare sector, you know, the mental health systems, and the criminal justice system? Is how do we start shaking out resources from those systems as we realize that people experiencing chronic homelessness intersect with all those other systems? That said, I think there are certainly new frontiers for supportive housing, and that is really to figure out how do we make supportive housing a solution for helping us bend the Medicaid cost curve. As we know, many people who are quote unquote super utilizers of the Medicaid system could also benefit from a combination of housing services that looks a lot like supportive housing. Mm-hmm. And then as we are trying to also solve the reentry crisis, and you know, as much as I'm part of the U.S. Interagency Council on Homelessness, we also do a lot of work with our sister council, the Federal Interagency Reentry Council, and they have fully come to realize that supportive housing needs to be a part of the toolkit for solving the reentry crisis in this country. So I guess in sum, I would say, you know, we need to think about chronic homelessness as not just a homelessness problem per se, but also a problem that touches a lot of other systems, and we need to begin talking about that. We need to begin selling that idea to other mainstream systems. And then two, we need to figure out how we can take the supportive housing idea and sell that to those systems like healthcare, like Medicaid, like the correction system, like child welfare.
Great, thank you. Luke?
I think they captured it pretty well.
All right, great. I think before we move on, I want to mention that I said at the outset, and both Jennifer and Richard have already alluded to the incredible proposed investments in the President's FY16 budget. And I will probably make a couple of plugs as we go through of how important it is that we all work together and coordinate and develop strategies for advocacy around special purpose vouchers, advocacy around Section 8, advocacies around McKinney-Vento and other core programs for us. So that will certainly be a theme as we talk through. Luke, I'd like to ask you if you could talk to us a little bit from your perspective at the White House about your work on ending veterans homelessness as well as other efforts, and kind of from the perspective at the Domestic Policy Council, what do you think have been the keys to success in those efforts?
Well, first of all, thanks for thinking of us and inviting me to be a part of this gathering. This is an incredible opportunity to be here, and I'm grateful for it, so thank you. You know, I think what is amazing about the approach that this president has taken to this work is that for so many years and through so many presidencies, you've had folks think about how to manage the intractable problem of homelessness, and thinking about it and talking about it and going about the work in that way. And, thanks in no small part to the incredible leadership that we've seen at USICH and HUD throughout the administration. I know Barbie's here, and Laura and Matthew have both done an extraordinary job. And obviously, Sean, Secretary Donovan was a huge leader on this. You've got a president who has not said, all right, let's figure out a way to manage this problem a little bit better. Let's figure out how to incrementally improve our approaches, but rather we need to figure out how to end homelessness in America, and then we need to do it. And your question was about veteran homelessness. The reason why, and I think folks know, veteran homelessness is the sort of first goal in terms of timeline. It's just we're closer. And we've had more success at getting resources out of Congress. This work requires resources, and we've seen a bipartisan commitment to providing those through HUD-VASH and through SSVF. So I think, the idea that you have a first lady out there talking about, you're talking about permanent supportive housing and the path to getting people to understand its importance and value as an essential tool in the toolkit to ending homelessness. The idea that you have a first lady out there talking about housing first and the importance of a housing first approach, you've got a president who talked about homelessness in the State of the Union address. That was the first time that happened, as far as we could tell, that a Democratic president was talking about homelessness in history. And the last reference we could find was Truman talking about homelessness for refugees in other countries. So I think what has changed fundamentally is focus and commitment from leaders right at the very top of our federal government. And I think we are fortunate that has that's been a shift that has happened at the same time as so many folks across the country, and in fact, just about everyone is in this room, or probably texting you guys right now if they couldn't make it. But it happened at the same time that folks across the country developed the extraordinary evidence that we've seen and improved the technology that we have in terms of how we serve those in the greatest need. So the way we are thinking about this work in terms of the veteran homelessness goal, but our goal is to end chronic homelessness and family and youth homelessness. The way we are thinking about this work is that we are at a pivotal moment now where you have the focus and commitment of the President of the United States and his leadership team. You've got extraordinary work happening as a result of practitioners and volunteers and mayors and other local leaders all across the country. And we are in a moment right now where if we can make some of these investments, your budget reflects your values always, right? But it also reflects where you see an opportunity, because there are always hard choices, where you see an opportunity to make something real and important happen. And that's why our budget has year after year, and including the one that we've sent up to the Hill right now, reflected our belief that if we can make some of these critical investments in more permanent supportive housing, vouchers that are targeted to veterans, but also folks who are other than honorably discharged, we can prove, not just with veterans, but success there, I think, leading to folks understanding that it's possible in all populations. We can prove that this is not an intractable problem to be managed politically, right? This is, as we are demonstrating, a body of work where we are showing that we can serve our brothers and sisters and solve the problem by ending homelessness. And that's how we're thinking about the work. That's how we're going to continue to pursue the work. And we have a budget up on the Hill right now that, if they act on it, is going to make it possible for us to achieve those goals together. And so we think there is an extraordinary amount, to your point, riding on the question of, will our nation's budget reflect the values that we all share and the importance of the opportunity we have to end homelessness for veterans, for the folks who are experiencing chronic homelessness, for families, for youth. In the next few years, this is the immediate future we're talking about. It's an extraordinary opportunity. We can't pass it up.
Great. Thank you very much. And just want to take one moment to publicly thank all of you all at the White House and certainly President Obama and the First Lady for the incredible leadership on these issues. I think you're right. It is just amazing, the commitment that has put out there. And I think, for all of us, I think one of the kind of issues and challenges we have is to go and make that case to our friends on the Hill on both sides of the aisle, demonstrate how these efforts make sense. They're smart investments. This is a nonpartisan issue that folks ought to be able to get behind and realize that we can improve lives and reduce costs if we make the right smart investments. So thank you very much, Luke.
Andy, can I jump in for a second here? I just want to, and I'm going to embarrass Luke for a second here, but I just think it's so cool that Luke is here, because he's the guy who's not at all the homeless conferences, but he's actually the guy who's doing all the behind-the-scenes work in the West Wing, focused on homelessness, and I think it's just fantastic that he had a chance to come and speak about this with all of you. When I came to Washington, I thought, somebody prepares secretaries with really good talking points and prepares other senior leaders in the administration with good talking points on homelessness, but they probably don't actually know a lot about it. And I assume that people like Luke didn't know a lot about it. These guys actually know a ton about homelessness, and it's just been an amazing experience to see how much people at the highest levels of the administration talk about this on a day-to-day basis. And Luke, I'm not sure if I'm allowed to say things like this, but the fact that we now have a monthly meeting in the West Wing where Luke calls Jennifer and Matthew and I and others at VA to come talk about, what are we doing to end veteran homelessness on in a really detailed way. That's pretty incredible to me, who's worked in homelessness for a long time, and now to see in the same room where they talk about really big issues of national security, we're also talking about ending veteran homelessness. That just shows how much this administration cares about this.
Great. Thank you.
Thank
you, Richard.
Richard is very kind. We're very fortunate to have an extraordinary team working on this all across the federal government. So I'm happy to be part of it.
Thank you.
Jennifer, if I could turn to you, I'm hoping you could talk to us a little bit about what has been the most exciting part in your work in DC around trying to kind of coordinate and connect dots between our federal partners at Health and Human Services and HUD. And importantly then, with that, kind of what you're learning that folks here should be taking back as they go back and talk with their housing finance agencies, with their state Medicaid agencies, with their public housing authorities, lessons that you could share for them.
Let me just say, every day is kind of amazing out in Washington, D.C. And I know I've known a lot of you for a long time. I think, frankly, when you asked me to come to D.C., I think there are a lot of folks in this room who thought that wouldn't last very long. And I was probably chief among them. Folks don't know, I actually couch surfed for the first year and a half I was in DC because I just kept waiting for somebody to say, ooh, you crossed the line, time to go home. There are so many amazing things that happen. Sitting in the White House at the big kids table talking about national strategy to end veterans homelessness is pretty cool. It's a little intimidating, it's very cool. Meeting the First Lady and having her be out in front on ending veterans homelessness is pretty cool. Being with Cyndi Lauper at the Congress, talking about ending youth homelessness, super bizarre. But specifically, I think you asked about the work with HHS and HUD.
Right. Let's be clear, Cyndi Lauper is a little bizarre, as wonderful as she is.
Barb will remember this, though. The day that we went and met Don Berwick, who was the head of the Center for Medicare and Medicaid, it was like I was going to meet a rock star. It was the most amazing moment for me when he came through and I got a chance to shake hands. I think that one of the things that if you haven't worked for government or you haven't worked for the federal government, it's hard to appreciate, especially with the way that the media works today. The hard work, the commitment to mission. I'm looking at Fred Karnas. You've been there. I'm looking at Norm Suchar, who's new to our HUD team, and we are so glad to have him on board. It's really easy to kind of write off the federal government as being completely dysfunctional right now, or to think that public servants aren't pulling their weight. And one of the things that really has been so incredible about being in Washington and being at USICH, where I got to work with 19 federal agencies, now being at HUD, where I work with folks in headquarters, but also in all the field offices, is how many really hardworking, committed, smart, creative, data-driven, research-driven people there are that are working inside of the federal government that want the same things that we all want. And it is a thankless job. We're lucky. We get to get out. We get pats every now and then. But a lot of people who do the work don't get those thank yous. They don't get that love that we so often get. But this is hard stuff. You know, when the Hearth Act got passed, this is about regulation writing. This is about trying to figure out how to juggle multiple priorities at once. This is about learning how to talk across systems. This is about, in our relationship with our friends at HHS, it wasn't long ago that you couldn't have healthcare people and housing people stay in a room together and talk because the healthcare people started babbling in 1915-ness and the housing people would fall asleep, and then the housing people would start babbling in low-income housing tax credits, and the healthcare people would fall asleep. And I think that what has really happened in a phenomenally different way is that not only are we learning how to talk to each other in a language that we both understand, or learning a little bit. It's kind of like ordering a beer in a foreign country, learning enough about each other's language in order to be able to talk across it. But I actually think that we are working on things together and problem solving together around common goals, common problems to be solved. And so the everyday work inside of the agencies in Washington, D.C., From the public, we only do three things. We put out a budget, we put out a funding notice, and we put out awards. And, I get it if you think the other 362 days a year we're not doing anything. But it takes a lot of work to get that right, and a lot of it happens not in the public view. But, the relationship that I have with HHS, from the Secretary's office to the Medicaid office to the Federally Qualified Health Center office and the folks over in the Substance Abuse Mental Health Services Administration, the folks in the Administration for Children, Youth, and Families. I mean, there are so many people doing so many projects together, whether it's promise zones and economic mobility, whether it's making sure that your home is healthy and not killing you, whether it's about strategizing together on how to make Medicaid pay for the services that it absolutely should pay for people who have disabilities. I mean, we are doing that work together every day. And so I guess the one thing that I would just say, I've been in DC long enough to wear the label Fed, but I wear it with pride. And I hope that you know that you're not alone, and we're working with you. It's just that sometimes it doesn't come out very often. And we're working together in ways that are completely unprecedented with the VA, HUD and VA and USICH, with HHS, with labor, with Tom Perez as chair as USICH and the head of the Department of Labor. This is a great opportunity to do some cool stuff on employment. So I don't remember what your question was, Andy.
You're good.
Can I add to that? So Jennifer, when I first started at USICH, you gave me kind of the pep talk about how to do this job well. And the first thing you said to me was, you don't need to make a case to the folks that you're going to be working with. They all get it. The hard part of this work is not that they need to be convinced that supportive housing, that paying for services using Medicaid in supportive housing is the right thing to do. The hard part is figuring out what are the federal policy levers, because so much of these decisions are state and local decisions. And what the federal government has at its disposal is tools like guidance, it's tools like messaging, it's tools like doing webinars, it's tools like funding solicitations. And those are kind of indirect tools. We can't make anybody do anything. We can't make states say we're going to cover supportive housing services for everybody who's experiencing chronic homelessness. We'd like that to happen, and I think it's just figuring out how do we pull those levers. So some of what may come out may not look that clear, but I think there's absolutely work that's happening. And it often comes in little bits and snippets. In HUD's guidance, for example, on how to prioritize people in permanent supportive housing. And Norm, I don't know where you are because there's these bright lights shining in my face.
Right
but one of the things that HUD wisely did in that notice, I might use those sunglasses.
Nice.
One of the things that HUD wisely did in there was to say, right now you're working on creating prioritization criteria and using coordinated entry systems to do this. There will be a time in the future when Medicaid pays for services in supportive housing, and Medicaid's going to have its own way to define vulnerability, high needs, and at that point, COCs and Medicaid departments should figure out how to align their criteria. I mean, those are the kind of ways that we're trying to break down silos, but it's in subtle places, and it's in the kind of federal guidance speak. And if that's not clear to you, then that's what we're here to try to decipher for you. So please tell us when we need to do that. Sorry.
Great, thank you. And Richard, I actually want to kind of in part follow up on that. Certainly at your perch at ICH, one of the key issues is implementation of opening doors in the federal plan, and how you, I think Jennifer alluded to the 19 agencies and how you think through that kind of collaboration. I'm wondering if you could share with us a couple of insights based on your experience thinking about how we build that kind of common vision and common goal around homelessness when certainly agencies are coming at it right from disparate viewpoints, different budgetary frameworks, different regulatory frameworks, quite candidly, right, different missions and goals that they're truly responsible for, even though these other things are tied to them. So talk to us for a couple minutes about kind of how you see the strategy in succeeding in kind of connecting those dots and building that coalition around the goal.
Yeah, so I mean, I think there are probably people out there who believe that the opening doors plan is something that lives on a shelf, and we kind of look back at it from time to time. I mean, it's actually absolutely the playbook for everything that we do, and I have to credit Barb and Jennifer and others who were at ICH and who helped to draft that. I know it's the work of Barb and Jennifer. You will always say it was the work of 700 people across the country, and it was
When
a
you're
collaborative
responsible
effort.
for incorporating edits, you feel that there are 700 people around the country that are providing
It's a
input.
lot of track changes.
It's a long track changes.
But
yeah.
but I think what I'm trying to get across is that it is absolutely our playbook. It's and I think the testament of that is when you have when you're having a conversation with one of the agencies that you're trying to work with, and they quote back to you something that's in Opening Doors, and they say, but you said in the federal plan that this is what we're going to do, and I said, oh yeah, you're absolutely right. And so that's when you know that all the federal agencies are really aligned around this. We're amending that plan this year. I think it's a matter of weeks when we will have that released. And one of the things we did when we looked back at that, and we solicited a lot of public input about what we should change in that plan. And what we've kind of found through our conversations with many of you, through our conversations with our federal partners, was largely the plan that was adopted in 2010 is exactly the plan that needs to happen going forward, and that we made a few tweaks. We added a few things that we thought really needed to be added, a greater emphasis on data, much more clarity on the role that Medicaid can play in paying for services, a little more clear language on what retooling the crisis response system means. But largely the plan remains the right plan with the right strategies. And I think there are times when I often think that I'm coming up with some brilliant idea for what we could be doing, and I think, oh, this is something that we should really be doing, and it's not in the plan, and I go back and look, and it's actually absolutely already in Opening Doors. And so, which just shows that I don't have any original ideas. But I think to your point, Andy, I think the thing that I've learned from working at USICH and kind of coordinating this work across 19 federal agencies is that that plan is really critical to make sure everyone's on the same page, and how much every single word that was on that plan was negotiated and agreed upon by not only 19 agencies but also many hundreds of people out in the communities, and that plan then becomes the prescription for what we're driving towards. So I know many of you have local plans, many of your own plans to end homelessness, and I don't know how much of you all follow the plans and actually implement those plans. I don't know how many of you actually look at the data to make sure that you're sticking to the plan. How many of you actually will rate the people who are involved in that work on a regular basis to say, are you actually sticking to what you had said you were going to do? We do all of those things. We hold up a report card to our council members. We have cabinet secretaries who look and actually they get told where they're not meeting their targets or where they are meeting their targets, and that's the kind of accountability that we've built into this.
Can I jump in on that
Yeah.
as one point too? Because I think it's an important one. Is that 6 months it took to write that plan, and ever since we've been acting. And I think one of the things as I travel around the country is that I encounter communities that seem like they're still planning. And it's like, where's the part where we do? And yet in other places, God love you Texans, like, that's right. We got a little bit of Texas at HUD these days. God love you Texans, because like, you never let a planning meeting get in the way of acting, but that doesn't mean that you're acting foolishly, because you are grabbing the data and you're grabbing the evidence and you're course correcting as you go. And so I think there is this kind of just this context. We love to hold up the plan, but the interesting thing is what's getting done. And then just the other thing I want to say on collaboration, and I think the White House has been amazing, because there's nothing more consensus forcing than a meeting in the West Wing. And, but the work of collaboration is really, really hard. And I know a lot of you are working in communities, or you're trying to work across system, and it's really, really hard. And you don't have the same data, or you can't give each other your data, or you just, you're working on different subpopulations or something. The work of collaboration is really, really hard. And so is the work of ending homelessness. So is the work of creating supportive housing. This is just the next hard thing that we have to do. But it ain't for the faint of heart. And you have to be willing to get in there and fight a fair fight. And you got to be willing to admit every now and then that you didn't know everything and that somebody else has something that you need. And if you're not willing to roll your sleeves up and get in there and stay in there, then you will simply revert to the way things always were. And no place is that more evident in the hard-won relationship that we have with our friends at the VA. Mm-hmm. And I tell people all the time when I get out in community, we fight. We fight quicker, we fight better, and we get better results faster now than we ever did, but we fight. And if you're not willing to do that, then you're not at the heart of the matter. And so I just want to say that about collaboration, because we can sit up here and hold hands and make it look all nice, but there are days it ain't so nice.
Mm-hmm. Can I say like a very quick note on that? What you are talking about, right, is managing to the plan. And I want to highlight something that Richard said that I want to make sure everybody leaves here remembering. The way that the foresight that was shown in drafting the plan the way it was, but then the way it has been managed to has resulted time and again in cabinet secretaries sitting together in a room asking, why am I not being rated higher on getting this done? What does my team need to do to make sure we are executing this part of the plan? It would shock you to know that some folks who end up being cabinet secretaries over the course of their lives are like fairly competitive people. And it is a pretty healthy prompt from USICH, and I think you guys have done an extraordinary job of it, of making sure that folks are being very clearly told how well they are doing and how well they are doing compared to their peers in executing against that plan. And I think that's in large part why we've seen such progress.
Well, we're all graduates of the Bar Poppy School of Management.
Great, thank
actually,
you all. And I think that
is Adrienne Bridenstine here still?
I saw her earlier today.
Adrienne,
too. Next to Barb. Yeah.
The report card that you created for opening doors is still being used today. So I just want to let you know the red, green, and yellow dots still live on. So.
Great. No, thank you all. I mean, I think certainly, right, as we're doing all of this work, the ability not only to collaborate and do that, but to hold ourselves accountable for that and thinking about being in it for the long haul and the long term and fighting through the fights, I think, Jennifer, is a really great point. Luke, I'd like to turn to you. And we've talked earlier about, we're so appreciative to have you here for your leadership on homelessness and supportive housing, but also recognize that you have a broader portfolio. And I'm wondering if you could talk for a minute or two about whether it's around promise zones or pay for success initiatives that the White House is thinking about, and kind of how those types of initiatives and efforts might kind of fit in and complement some of the work that we're doing around supportive housing.
Sure. Happy to talk a little bit about that. So just to give, I haven't had a chance to meet everybody here. So for those who I haven't had a chance to connect with, just to give you a sense of my portfolio, I work on the President's Domestic Policy Council, focused, as you might guess, on everything we can do to improve economic mobility all across the country, particularly focused on revitalization of high poverty communities of concentrated poverty across the country, and work with HUD on our assisted housing portfolio and sort of housing policy generally. And our SNAP and food stamp work. So there's a range of different things that our team is doing, I think all of which are tied directly in some way to the need to get this work right on ending homelessness and benefit from what we have learned and how we are going about the work. I would say that the most direct benefit has been that the entire body of work I just talked about, obviously this is work that's been happening all across the country for decades. I'd say what has been a marked step forward over the course of the last few years is the willingness on the part of the president and all the way down to hold ourselves to account for using evidence and doing so in a more rigorous way, I think, than has ever been done before, and investing in building that evidence to guide social policy making, whether you're talking about ending homelessness or improving economic mobility, and investing in the kind of data infrastructure, both at the national level and at the local level, that's required both to track your progress against those goals and to build better evidence. And so, you mentioned Pay for Success. I think, that's just one area where it may be obvious to everybody in this room that we are seeing enormous improvement in quality of life and extraordinary cost savings as a result of investments that we've made in supportive housing or connecting supportive services to elderly Americans to help them age in place. But we are sadly not in a place where folks are willing to score those savings, right? Or where we have built a strong enough bipartisan consensus that the savings are so great and the improvements in outcomes for the folks we're serving are so great that we have to invest more. Mm-hmm. We've been asking for it in our budgets, but there is not, I think it's fair to say, a consensus that our nation needs to make these investments. Or I assume Congress would be sending us appropriations bills that matched our budget. So where I see a lot of hope in Pay for Success and in the potential outside of Pay for Success to do more large N, rigorous studies, RCT or quasi-experimental, but RCT whenever possible, is in building both a stronger body of evidence, but also a stronger narrative for the general public who hears very little about and knows very little about what we're talking about in this room. And that's on us. We need to solve that problem. And I think the Pay for Success opportunities, the opportunities we are generating through Pay for Success investments, and I know CSH is doing an extraordinary job with their Social Innovation Fund projects. The opportunity is to have not just the New England Journal of Medicine, but to be parochial, I grew up in Central Phoenix, the front page of the Arizona Republic saying, here's what we are achieving, both in terms of cost savings and in terms of improving the welfare of our brothers and sisters who need us most. And when we're in a position where there isn't a bipartisan consensus around making those investments and building that body of evidence, with direct government investments, Pay for Success is the way that we've got to go. And so we've been using that same model and learning from it, not just in the context of homelessness, but then in all of the other work we're doing to improve economic mobility nationwide.
Great. Thank you very much. All right, so we have time for final thought from each of our panelists, and this could be your crystal ball moment. It can be your drop the microphone moment. You can
it's going to be hard to draw.
pick your poison.
It's in the shirt.
Regardless of what you choose, it needs to be respectfully brief. So let me start with Richard and then go to Jennifer, and then we will close it out with Luke.
So, very brief, Andy, you know me better than that.
I know.
So,
I tried to, that's why I went brief, then Richard.
Pot, kettle black.
You have a fair point.
So two quick points. One is of all the things that we know works to end homelessness, I think the thing that we know works best to end homelessness is permanent supportive housing. I don't think there's any other intervention that has quite the evidence behind it as supportive housing. And that's not to say that supportive housing works for everybody, but that it's, it took a lot of work and a lot of years. And Connie, you know this, all the fights about getting data and access to build the evidence base. I mean, that was hard work across a couple of decades to really build that evidence. But now that we have that evidence, we have a really firm belief that supportive housing is an intervention that is really solid, and it is fantastic to have a national organization like CSH, who's been the kind of champion for supportive housing for all of these years. The other thing I want to say, though, is as we think about how to, I guess the other thing we've learned about ending homelessness is that, different folks need different things, right? So not everybody needs the fully packaged, integrated model of housing services that supportive housing is. Some people need other kinds of assistance. And I think that what we have the opportunity to do is to say, not how do we create other models and start from scratch, but how do we learn from what we've learned in supportive housing about how to pair housing and services together, and think about what lessons we can expand upon to create housing and services interventions for a broader set of folks. How do we take the lessons about combining those two things? There are people for whom, I think every person experiencing homelessness needs some combination of housing and services. And the degree to which you package those up is really what you vary. It's not that some people only need housing assistance or services. Sometimes those services are about what you can leverage from existing community-based services, and how do we use that housing as a platform for helping kind of broker and collect those services to better serve people experiencing homelessness. So anyway, I think the new frontier for supportive housing needs to be, we keep the integrity of that model, but we need to take those lessons and we need to broaden them. And we need to use those lessons to apply to create other kinds of housing and services models for other populations.
Great. Thank you. Jennifer.
First, I just want to say thank you for being here. CSH made me the person that I am. And supportive housing, I think, and all that work, it's so powerful, it's so transformational. And I think the thing that bothers me the most sometimes is the way that we have to pathologize people to convince systems. And one of the things that I miss the most about being at home is that doing the work in a community, you get to meet the people every day in the work who used to live on the streets, who used to be in shelter, who used to be incarcerated or in and out of hospitals or wherever, and they don't become a chronic or a dual or a super utilizer. Right. It's Mike. And Mike has a story. He's somebody's son and he's somebody's brother, and he had a life, and something happened, and then something else happened, and something else happened. And when he's housed, he gets his life back. And so I think for me, as we think about getting to Medicaid or getting to the criminal justice system or getting into the child welfare system or all those places, it's how do we not develop a shorthand that pathologizes, but rather develop a language that really remembers that we're talking about people who perhaps have lost their capacity to hope and dream, but they're maybe one home away from getting that back. So send that love to us, because it's hard sometimes to feel that every day in DC. The second piece that I just want to say is that we're talking a lot about homelessness because we're collectively on the end homelessness train here. But supportive housing is happening in many systems already. The Children's Bureau folks are doing a child welfare supportive housing project. I work on aging and disability in addition to homelessness, and the work on Olmstead and deinstitutionalization and rebalancing is using supportive housing. We better pray for a good supportive housing model that helps us age in place. It's not just that some people need housing and services. I would posit that we all need housing and services, and we got to figure out how to get this right. So, supportive housing is a concept that we don't have to run around with a big PowerPoint to sell anymore, but we still have to figure out how to scale it, and scale it in a way that it doesn't become another system that systematizes people, but becomes a home that really liberates people to be who they can be. So.
Great. Thank you very much. Luke?
So there are three things that I'd like to say. The first thing I want to say is thank you for the work that you're doing. A lot of the people that Jennifer was just talking about are people in our lives. A lot of the veterans that we're trying to serve, in our work to end veteran homelessness, are veterans that we have known and have loved, and they've been friends and family. And you, in your work every day, are changing their lives, and I couldn't be more grateful to have the opportunity to thank you for that work. The second thing I want to say is that we've been talking a lot over the past hour or so about the steps that the federal government has taken and that this administration has taken in the last few years, and in a pretty positive light. And I think that's for good reason. I think folks are rightly proud of the work that those who are at the wheel now have put in, and also, I see Fred and Barbara and others in the audience, the work that folks who are now serving in their communities put in. But there's no question that we could be doing better. There's no question that there are things that we're not getting right. And I'd like to ask you, when you have a little time to think about it today or tomorrow or over the weekend, to think about what we could be doing better, to think about what we could be getting right, how we could be a better partner to you. My email address is ltate, it's really easy, first initial, last name, ltate, L-T-A-T-E, at who.eop.gov. Please let me know if there's anything that our administration or the White House could be doing better to do a little bit more blocking for HHS or HUD, so that they've got room to run. I know that the president sees these next 20 months, this fourth quarter, as our opportunity to make sure that we feel like, that we know in January 2017 we have done everything possible to make life better for the American people, and the work to end homelessness couldn't be more central to that. So please, again, it's ltate, L-T-A-T-E, at who.eop.gov. So please let me know. The last thing I'd say, we need to take this opportunity that we have right now more seriously than I think it's currently being taken. To have this sort of a commitment from the president, to have a budget that is on the Hill right now that would transform, I think it's fair to say, what we're able to do to serve our brothers and sisters in need. To have the evidence that has been built, to have the knowledge that we can solve these challenges, and to not act would be an extraordinary mistake and failure of governance. And so we need you to take as a central mission in your work the task of ensuring that everyone understands what an incredible opportunity this is, that everyone understands that this is a problem that we can solve, that homelessness can be ended in America, and that we know how to do it, and we just need to invest in the strategies that are proven to work in order to do it. Everyone in your communities, everyone who you work with, the folks who you may not be working with or talking to, but can influence whether or not we make the right decisions here in the next couple of years. This is not going to happen just because we are asking for it to happen. It's not going to happen just because we have a plan that we have laid out, unless we can take the actions we need to take to make that plan reality. We will fail. And this is too important for us to fail. So we need you. Pardon me. We need you desperately right now. And I certainly hope that the next time this group reconvenes, everyone feels like they have done everything in their power not to let this opportunity go by. And I know that's what will happen. So thank you for that.
Thank you. All right. Thank you so much to our panel. I think our president and CEO, Deb DeSantis, is coming up. I think we're going to stay seated and be a nice background.
So while Deb and Dorothy are walking up, I'd love it if you'd pull out your mobile app. And I'd love it if you could search for this session. And I'd love it if you could give it the number of stars you think it deserves. 5, 4, 3, 2, 1, hopefully 5. And then I'd really love it if you go back to the opening plenary and rate my boss. How did she do in that opening plenary? And make sure you give her some stars. You can do that all in the app just by going to the session, and you can do some feedback. So we're going to get closed out by Deb.
Great. Thanks, Liz. So we were wondering whether or not we were going to do another conference next year, but since the White House set the expectation that we'll be back next year, I guess that answers that question. So thanks, Luke. Last night I was walking back to the hotel with a couple folks, and I said, so give me some feedback. What worked for you? What didn't work for you? And one of the women I was with said, I'll tell you, the truth is, I really wanted a bag. You guys didn't give out bags, and I'm kind of unhappy with that. So Gladys, if you were here, I had my very own personal CSH extra bag stowed in my suitcase, and I'm going to give it to you because I don't want to look at the feedback and see your comment about no bags being given out at the conference. On behalf of CSH, I want to thank you all. You know, we like to think at CSH that we set a high bar for ourselves. And I think we did with this conference. We really wanted to create a structure that involved you, that got you up and participating and sharing with us your best thoughts about how we move this effort forward in a very meaningful way. And you exceeded our expectations, so I thank you for that. I'm so excited about the conversations that were had these past 2 days, and I'm more excited thinking about what's ahead for us and the opportunity ahead of us. But I do want to echo the sentiments of the panelists up here. You know, collectively, we are powerful. When we're out in the field doing our own work, it might seem like, you know, it's just an uphill battle because it's just us. But collectively, it's powerful. So let's use that collective power and let's have an impact in DC and let's let them know what we know, what Luke said, what Jennifer said, what Richard said. Supportive housing works. Jennifer, when you said double down, I think all CSH staff went, oh. Because about a year ago, we were all together for an all-staff meeting. I said, people, double down. So that's what I think it's about. You heard Jennifer say it. Like, we know what works. Let's just double down, people. So I want to thank all CSHers who worked tirelessly to pull this together on top of their day-to-day work, with a special thanks to Liz Drappa, Stephanie Seidman, and Kathy Vida. And a real big thanks to our sponsors, United Healthcare and all the other sponsors that came together and really gave us the ability to put together, I think, a really interesting experience for all of you. So, Don Berwick, really?
Yeah. Sorry,
I want to introduce my version of a rock star. I have had the pleasure of having Dorothy Edwards on the CSH board. The first plenary session the other day, Bill Pitkin from the Hilton Foundation talked about an effort that Hilton has been supporting in California, working to develop leadership with tenants throughout LA County. And so Dorothy is one of those special tenants of supportive housing who has taken the charge of advocacy very seriously. And so Dorothy's been spending a lot of her time up in Sacramento and California advocating for supportive housing, working with government in Pasadena, advocating for supportive housing, and also in Los Angeles. And it has been such a pleasure, such a thrill to have Dorothy on the CSH board and bring her experience to our work. And so I wanted her to close us out and remind us all the power of supportive housing and why what we do is just so important. So Dorothy.
She's the rock star. I just want to tell you all, thank you so much for all that you do. And if it wasn't for all your work together and apart, I was broken, and I have a beautiful home, and I have a future, and I can't explain how that feels to not be able to look at yourself in the mirror at one time in your life, and then this new time, I look at myself all the time with pride, and I feel like there's nothing I can't do, and I owe that all to all of you, and I appreciate everything you've done for me. Thank you.
All right, safe travels, everyone. Thank you.